LinkedIn. Hello, 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 and welcome to our Fireside chat. I want to make sure that I am live on LinkedIn before we get any further in the conversation. Go ahead and come in, get settled. I hope y'all got some coffee or a nice beverage or whatever you need for our session. I don't anticipate us being any longer than an hour, but I don't know, I just have a feeling me and you can probably talk a lot, Brittany. Let's
I
see
think
here. What'd you say? We've been having rush conversations since we met. And I'm so glad that we get to the time to really just sit down and have this conversation today. So, can you see me? Can you see where I'm streaming live? I want to make sure before I go any further.
so. Yes, I can see you screaming live on
Yeah,
your
yeah.
consulting
Okay,
page.
okay. Wonderful. Great. Wonderful. Hello, everybody, and welcome to our fireside chat this evening. I am Quisha Umemba. You may know me as the CEO of Umemba Health, which is a public health workforce development consulting and training agency where we help public health systems and healthcare organizations to educate their workforce, empower their leadership, and expand their community presence. You also may know me from Quisha Umemba Consulting, where I teach helping professionals how to leverage their expertise, package their genius, and monetize their skill set so they can start, grow, and scale a profitable public health consulting business that makes impact and income. And if you are here watching me on this page and know me from that particular business venture, then you know me to be the public healthpreneur. So I wanted to welcome you for our session tonight and look at my notes here, make sure that I stay on target. If you did not know, it is National Public Health Week. So if you are in public health, happy NPHW. For those of us are celebrating, National Public Health Week is usually in April. So this year it's April the 1st through the 7th. It is a week where we acknowledge the achievements in public health. It has a theme every single year, and it also has a daily theme as well. And so this year's theme is protecting, connecting, and thriving. We are all public health. And today's daily theme you see on the ticker at the bottom of the screen. I'm sorry, let me actually silence this watch because it's throwing me off. Today's theme is new tools and innovation. And y'all, when I saw the themes for this year, I got really, really excited about this one. And Brittany knows this. I've really jumped on the innovation train, for lack of a better way to say it. And so when I met Brittany a couple of weeks ago, when we were talking about some of the similarities and just the excitement for the trends that we see in public health coming as it relates to technology, artificial intelligence, etc., I thought, oh my God, this is a perfect opportunity to have a conversation. I know just the right person that I can have this conversation with. And I'm so grateful that you were gracious enough at the drop of a hat to say, yeah, Quisha, we can do that in 2 nights. Sure, not a problem. So thank you so much for that. So let me say, we're here tonight to talk again because the theme for today in celebrating National Public Health Week is new tools and innovation. But this is the reason why we need to have this conversation, y'all. We got to get on the train or get left behind. I just mentioned the innovation train. You'll hear me say the AI train. I know, and Brittany know, and we've had conversations about this, and I'm sure those of you that are watching or listening know that when it comes to public health, when it comes to healthcare, even though we consider those areas to be innovative, a lot of times when new technology comes to us, it is not new, y'all. It has been around for decades, at least years, and it has been tested and run through the mill, and there's been all kinds of trials and everything else before that comes to us. As a matter of fact, the only thing that didn't do that was the COVID vaccine, and I'm not even going to get into that conversation. So I say this to open up the conversation we're going to have tonight. I encourage you to just be open. I encourage you to be receptive to the things that we're going to share with you and talk about. I think you're going to be absolutely amazed at the way that AI is being used and how it's being ushered into healthcare and public health, specifically in the context of this conversation. And I believe that what Brittany has to share with you is going to be extremely important for you and for your future of public health, whether you work for somebody else or whether you work for yourself and you're a public health entrepreneur like myself. So without going any further, I'm going to take time to stop right there, and I'm going to let Britney Mazyck introduce herself to you as well as her business and her expertise. Go ahead, Britney.
So thank you so much. Good evening, everyone. My name is Britney Mazyck, and I am from the lovely state of South Carolina, the upstate South Carolina. By day, I am an operations manager for a nonprofit community initiatives, and our biggest leg of our program, is our free clinic. And so I'm housed in the free clinic, and public health is absolutely a passion of mine. AI is another passion of mine through my side business, 31st and Company, where I'm helping nonprofits just learn a little bit how to incorporate AI into their everyday operations. So I meshed the two together. I meshed my side business or my business with what I do for my 9 to 5 and put them both together. And so here I am in this space with AI and public health.
I love it.
And it is an interesting space to be in. It's an interesting time to be using AI and innovating public health with the AI. So thank you so much for having me this evening. I'm looking forward to the conversation.
I'm super excited. I'm super excited about the conversation. So I just have to share about how we met. So has it even been 3 weeks? When did we meet, Brittany?
It maybe has been 3 weeks now, maybe a little bit less than three
Yeah,
weeks.
it's not been a month. I know. So we met in a thread on LinkedIn, and she mentioned the work that she does with not only AI and public health, but community health workers. And I said, oh my God, we have to talk. We have to meet. We have to connect offline. I think you actually reached out first. And I think we put something on the counter in the next couple of days. So the reason that this is exciting to me, at the beginning of the year, we kind of always set our priorities with my public health consultancy. And one of the areas that we want to focus on this year is artificial intelligence. It actually is a Q4 priority because we have a priority for every quarter. I share with you all, and I'll share with the viewers, I am getting a certification as an AI consultant. And I really want to, just kind of ride the wave, ride the trend. I think you've probably all heard the saying before, if it's not AI that's going to replace you, it's going to be someone using AI that's going to replace you or replace your job. And I was very much against artificial intelligence probably about 8 or 10 months ago, give or take. And a good friend of mine who is a nurse entrepreneur, she said, Quisha, you sound just like those people in the 70s and 80s that were really against the computer and really against the internet. And you know what, Quisha, you're going to be left behind. And that really stuck with me because I thought, oh my goodness, that's my parents and that's some of my relatives and that's some of my friends, older friends. And I'm like, they've really struggled to adapt because everything is digital now. And knowing that I have an agency where I provide learning and training and capacity building, I have to stay on the curve because here's the kicker for me. Whenever something new rolls out, there's going to be a skills gap. And my business helps fill the need, to meet those needs and to help with those technical skills or whatever type of skills it is. And so in order for me to be on the cusp of this technology, it really does behoove me to be familiar with AI, know how to use it, know how to train on it, and all of those things. So I had a conversation with Brittany, and she told me how she was using it. I could have just dropped the phone. And I said, where have you been? Why are you not writing about this? Why are you not talking about this? Like, how have I not heard of you? And I was really surprised that she said, oh, I've been on this. And I went on your LinkedIn, like, you've been posting about this for like a year. You've been talking about this, how you've been using it for like a year. So in the context of this conversation, I see we have lots of viewers that are on now. Thank you all for joining us. If there's a question, please put it in the comments. I'll be watching it. If you'll help me, Brittany, watch the comments as well. But just know you are talking to someone that is a very early adapter of artificial intelligence. and that is Brittany, and someone that is a very late adapter of artificial intelligence. But we're going to come from those angles, and hopefully you'll get to learn a little bit about us today. So, all right, let's talk about, before we get any further, let's talk about AI. And I would really love for you, if you can, in the simplest of terms, Brittany, tell us what artificial intelligence is, and more specifically, because we're going to be talking about ChatGPT and generative AI, some of those more broader terms, more foundational terms that people should understand when it comes to AI, and how we're going to be talking about how we use it tonight.
Right. So I always tell people when I'm doing seminars or consulting that AI can get very techie. Is my word for it. You can really get bogged down in the tech side of it, the big words, the machine learning, the deep learning, the generative AI, and all of these other terms and buzzwords that people are using and throwing out. But I like to keep it very simple because the simpler or the easier you keep it, the better it is for people to understand and implement. So AI for me is simply artificial intelligence. We know that's what it stands for, and it just um to me, I love to say it's a computer acting and thinking like a human.
Human. That's it. That's
That's
it.
all that it is. And like I said, if you Google the word artificial intelligence right now, they're going to give you this long definition, probably about a paragraph long, and they're going to have all kind of words about algorithms and computer systems but it's just simply the process of a computer being able to think and process and act like a human. And
Absolutely.
so I think by far, and please don't get me wrong, there are lots of AI systems out there. I am a chat GPT girl. I am very biased. I am so sorry for anybody who does not like Chat GPT, but I am kind of biased because OpenAI, the platform that hosts Chat GPT, was the first to hit the ground running when it comes to LLMs. And LLM just stands for large language model. Um, so if you hear people saying LLM, that just stands for large language model. And that is basically a algorithm or system that is interpreting text. So Chat GPT platforms like Chat GPT, Claude, and your other platforms, they are literally interpreting text. So the computer is thinking and predicting what your next word might be, and it's using that prediction to give you an output. A LLM is a type of generative AI. So when we
Yes.
talk about generative AI, we're just talking about AI that's going to give you an output. You input something and get an output. Because when you think about deep learning and when you think about machine learning, this is AI that does not give any output. This is
Mhm.
AI that's analyzing text, so going through data. But in order to get an output, that's when we step over into the generative AI side.
And can I pause you there for a minute? Because I think traditionally in public health and healthcare, we've used AI for a while.
Yes, it's been
You know,
around.
it's
Yes.
been around in the way that it's being used. It just hasn't been used on an individual basis the way that we're using it now with, like you said, some of the platforms like ChatGPT. And
Mm-hmm.
as you were talking, I thought about something else, because as I've been researching and learning more about artificial intelligence, like I mean, I knew it was a thing, but I didn't know it was a field of computer science. And so
Yes.
I'm so glad that you said don't try to like learn everything is so big, because I was like, I'm gonna be an expert. I'm about to go gung ho. I'm about to do. I saw the first equation. It was like y equals f x something. I was like, I'm about to learn ChatGPT and a few other tools. And I'm gonna keep it pushing because it's a whole field, and I'm not trying to get into it like that.
And I think
Yeah.
the beauty of AI and what I love about AI for people that don't have tech backgrounds. So I'm talking about your people who might just be using it every day, in their nonprofit or in their clinic or at their doctor's office. They don't have a tech background, don't have a tech degree, didn't go to school for tech, probably didn't even care about tech before they were using it like with their cell phone.
Yeah.
You don't have to know a lot of that background to implement. And
Yeah.
so I think a lot of times people get bogged down because, like you said, you see the formulas, you see the big words, and you're like, and you become apprehensive naturally. But I always tell people the most important part of AI is adapting and innovating and implementing it. Finding ways that you can use it and help solve day-to-day problems. And
And
once
that's
you do
yes.
that,
I'm so glad you said
yes,
that.
once you do that, you really tap into being able to use AI um in your area, whatever your area or your profession may be, and that's what's most important.
Oh, so if you're watching, you got to stay tuned. This is definitely what we're going to get into the nitty gritty is using it in day to day, and which is what I love about what you've done with it, Brittany, and why I feel like, and certainly, you've taken kind of my ideas and operationalized them. So stick with us if you are watching and listening. Let's talk a little bit about generative AI because there's different types, and I wanted you to kind of touch on that. Tell us about of course, people hear about Chat GPT, right? We know what that is for the most part and what it does, but
Mhm.
kind of talk about the big groups: text to text to image,
Yeah.
text
Mhm.
to 3D, text to task. Kind of talk about those a little bit.
So generative AI is so broad. It's kind of like I think of it as an umbrella. Generative AI is the umbrella, and then you have a lot of subsets of under. And so the subsets that are really, really, really popular right now are the LLM, and that is your text generated um, apps. I want to call it an app. You might call it an app, or you might call it software or website. But OpenAI, when it released back in November 2022 and hit the ground running, it hit the ground running because it was your first LLM that everyday people had access to. And so, for anybody who I know you say you're a late adapter, but you're really not.
I know I'm earlier than people that's probably watching, right? Which is
Yes.
good for me. We're talking about somebody that boycotted Apple for 10 years just because. So, yes, so I'm
So
not that.
you're really on the cusp of where this AI thing is going. And if you think of it long term, like I like to think about it, we're at the beginning.
Yeah.
And so OpenAI really rolled out November 2022. That's been less than 2 years now. We're in 2024. And so it is a LLM, large language model, and all that means is it's analyzing text. So you're giving it text,
And
it's analyzing that text, and it's using that text to predict what you're thinking. So the way that you can use AI to be more productive, and I don't want to get ahead of myself, is if it takes a human 60 seconds or a minute to read a page of context, of data, of a book, of whatever, AI can do it in 10 seconds.
yeah, yeah,
So
yeah.
what takes us an hour to do, AI can do it in minutes.
Right. We're gonna
So
get. Yeah, we're gonna get to some of that too.
that's how
Um,
you're increasing your productivity. But like you were saying, generative AI, that's just a general umbrella term. When Chat GPT or OpenAI first came out, it was a large language model that could only interpret text. It couldn't give you images, it could only give you text. It was text based. Since then, they've updated. Now you can do text, through Dial E, you can generate images inside the platform. It's multimodal. And I don't want to say it out loud, but they are coming out with an update that is going to allow you to do audio and video.
Girl, stop.
I'm waiting on that. And so
Exciting.
you can see how it's grown in that short amount of time. Like I said, less than 2 years. So we're right on time. Where somebody said right on time in the comments.
Right
We
on
are right
time.
on
Yeah, right
time with
on time.
learning AI and having this conversation.
So, I also want to mention because I don't want nobody to think, no, look, OpenAI is not paying me. Chat GPT is not paying me. Okay. I know we keep
They need to be
referencing.
paying me, but they're
I
not.
know. So for the sake of not being biased, let's mention some other platforms as well. That some text to text platforms. So I do
Um,
know. Correct me if I'm wrong. OpenAI is Microsoft, right? That is the Microsoft,
Open,
and then
yes, that's the
Google
platform that hosts Chat GPT.
that hosts
But you
Chat
also
GPT.
have, yeah, you also have Claude. Claude is great. And
Okay.
I'm using Claude now more and more as kind of like a backup to Chat GPT. But there's, oh my God, there's hundreds. We can't even name them all. There's hundreds of other platforms.
is Gemini. It used to be called Baird, but
Gem-
it's now called Gemini.
Co-
I've used it
Gemini
a couple
Copilot.
times.
There's
Gemini
Bard.
Copilot.
Yep,
That's
there's
what I'm trying to
Bard.
say. Yeah, Bard. Yeah. Now,
Yeah, so
no,
there's
Bard is now Gemini. If you Google it, because I just looked today, they've changed the name. They're no longer Bard. They're Gemini.
just Gemini now. Okay.
Yeah,
I
just
have
Gemini.
used Gemini just a few times just to kind of see how the platform works. But to me, and you have to forgive me, I'm so sorry because I am an Apple girl. I know that we had this conversation. I feel like some of these other platforms are just rushing to adapt
Yeah.
and they haven't fully got there yet for me. So I like to kind of stick with the original, but that's another conversation for another day. But when you're dealing with AI, I always say that you're either going to be Apple or you're going to be BlackBerry.
Yeah,
And
Blackberries.
we know
We still got
BlackBerry is obsolete.
right, right. So,
So, yeah.
there's also another one that I use quite a bit, Jasper. I don't know if you've used Jasper, and there's so many. Let's just say that
Mm-hmm.
Jasper AI. So when I first started using ChatGPT, I was like, this is not giving me what I need. And then I found Jasper, which is specifically for content marketing. I thought, oh, I really need to use this. And this is what I found out. It wasn't ChatGPT's problem. It was my problem. I didn't know how to use it. I didn't know how to prompt it. I did not know how to train it, to sound and speak like
Mm-hmm.
me and things like that. So speaking about prompting, or since I just said about that, tell us what prompting is and why that's so important when we're using generative AI.
So prompting is you communicating with these LLM, these large language models. And it's simply your input that you're giving to it in order for you to get an output. Why it is important, why that input, which is called a prompt, so that's where the word prompting comes from, because the better that you talk to the system, the better your output is going to be.
So
So
it's
if
like
you're more
it's like data,
detailed,
bad info in, garbage
bad
in, garbage out. Yeah,
garbage
yeah.
in, garbage out. It's the same concept. And so I like to tell people when you're prompting or you're getting ready to, start typing or talking, because you can talk to text as well. When you're doing that, you want to think about really five main areas: who, what,
So
when,
write it
where, and why.
down. Okay,
Those are the
wow.
five areas you want to look at: the who, the what, when, where, and why. If you can give it all of that information when you're talking to the system, it's going to give you some really, really good information back. If you leave out the who or you leave out one of those areas, you are going to still get an answer. Don't get me wrong, but it might not be the best answer. You're going to have to keep refining it and keep refining it. And I think people get frustrated because sometimes you can refine so much till you're like, you know what, forget it. And
But
that
I'm
is,
though that I definitely I dig and dig and dig and dig. You never take the first thing it gives you. We ain't gonna get
mhm.
into all that. Look, we'll do a training on that. We let's just kind of keep it surface level. So all right, so we covered text to text, and just for time's sake, there's text to image. There are platforms that you put the text in, it shoots out the image. I know personally I use Ideogram. It does words, it does pictures, it also does pictures with words on top of them. Do you have any particular
Yes,
platform that you
Dow
like?
Dow E is a great text to image platform. It has been incorporated into um Chat GPT. It's also incorporated into Bing now. Bing
Okay.
has Dow E built into it. But I also love Mid Journey.
I was just about to say Mid Journey. Yeah. Okay.
Midjourney is awesome, an awesome image generation platform. I also love Tingra, and it's pronounced Tingra, but it's spelled TENGR.ai. That's another, if you're generating images, another great source. But if you look at a lot of your graphic design software, Canva is now integrating AI where you can generate images.
That's true.
Um, PowerPoint, Adobe PowerPoint is now,
Google
yes.
Slides.
So a lot of your graphic design software is trying to rush and again adapt and integrate and build that into their software.
Yeah, even the generative AI, like if you use Grammarly or some of these other platforms, they're starting to, and some of them you have to upgrade like to the next tier or something like that. But they're
Hmm.
starting to generate some text for you as well. So you can do text to video, same kind of concept, and that's kind of what Brittany was alluding to when she said that OpenAI is going to start adding some video and different things like that. So I'm so excited about that. So let's talk about your favorite tools. I want so people can see kind of how we use them every day, just yourself and your business, and then also how you use them with organizations, and then I'll share mine as well. What are some of your favorite tools? So for those of you that are watching, you're taking notes. Favorite tool and what it does. Favorite AI tool.
Um, I like I already said, ChatGPT is my number one. That's my go-to because right now it's the only software where you can create GPTs, which and we'll talk about that a little bit more. But I do love Claude. I really love Claude as a backup for sometimes the chat GPT bandwidth, the algorithm gets a little congested and it's slow giving you answers. I can jump right over to Claude and use Claude. So I do love that. I'm a fan of Jasper. Jasper is really, really good. And I'm starting to use it more and more because I was so biased with ChatGPT. I had to tell myself, okay, girl, there's other tools out here that you can
Yeah.
use. And so I'm starting to use Jasper more and more. But like I said, Mid Journey, if I'm trying to generate images, oh my goodness, Mid Journey is my go-to. So those are just some of the
I haven't
platforms that
done
I
Mid
use.
Journey yet. I'm gonna have to use that. So okay, that's great. So for me, Grammarly, simple every day. I use that a lot.
Mm-hmm.
Of course, OpenAI, Jasper. I mean, literally, they're both open all day, most of the day. I talked about ideogram. Oh God, what did I just? This is my new favorite. I actually just trained our students at Omemba Health Academy on AI tools. Our CHW instructors. I love PDF.ai. Have you heard of that?
Yeah. Yes, I have.
And for somebody that is reading a lot and doing lit reviews
Uh-huh.
and developing curriculums and all of that, and so you upload the PDF, because this is what I did to write my book. I would copy, and there's a character limit in ChatGPT. I would copy and
Mm-hmm.
paste as much of the journal as I could, and then put it in ChatGPT and say, summarize this, give me the main bullet point, all of that. And so I would do that, but now with PDF AI, I just upload the PDF and then I interact with it directly. What are the main points? What are the recommendations? What describe this? And I even say, because when I was researching, preparing for this, I said, does this journal mention precision medicine or personalized medicine? Because I was looking up ways that we're already using AI in healthcare and public health, and it just scans all of that and gives it. And I'm like, oh, this saves so much time.
Yes.
Oh, save so much time.
Mhm.
So those are some of my favorite tools. I have some more as well. I'm trying to keep it to less than 10 because I already feel like in my business I have way, way, way too many tools, and I'm like, we should don't go crazy with the tools. Get your good core kind of 10 tools that you use and become
Mhm.
expert in those, and that's it. So, all right. So those are your favorite AI tools. Tell me how you use tools, and that's how you use them in your personal business. How do you use them with your clients? And this is where we're going to get into that conversation where you talked about those GPTs, and I would love for you to explain what that is too.
So a GPT, that stands for Generative Pre-trained Transformer. It is a part of the Chat GPT platform. So right now, and this is why I'm biased, OpenAI is the only software that has the ability to create these GPTs. It's kind of their signature thing, but I'm sure other platforms are going to be adapting soon. It's coming. But the beauty in the GPT is that you can program it to do a specific task. You can program coding. If you're familiar with coding, you don't have to code. But if you're familiar with training, with ChatGPT, you can tell when something was written in
Oh,
GPT.
oh my God,
You
Brittany!
know that lingo, that words like
As we
discover,
delve
delve,
into
unleash,
the changes
unlock.
in the ever evolving landscape,
It has that AI lingo.
yeah,
But there are ways to get around that because you can train AI to take on your voice. And
yes.
so once you start prompting and you start training it to speak in your voice per se, that takes time. But right now, you have to continue doing that over and over and over again for different. Let's say you have a professional voice. I use one voice at work, but I use another voice at home.
Absolutely.
And so the beauty of a GPT is you can train and program that GPT to create one specific task in your specific voice, and it's going for your specific brand, and it's going to do that every
Every single
time.
time. And I'm
Every
so
time.
glad you said that, because I have one GPT for Umemba Health, and it speaks in a very professional, B2B for organizations, and then for my
Mhm.
private coaching, it's me. It talks like me. I'm a storyteller, and so it's trained to be empowering and uplifting and tell stories and do different things like that. So I'm so glad that you made that comment.
So I took GPTs, I call it to a step further, to the next level. And I want to tell you the story because I told you this when we first met. I'm a problem solver, and I don't know if it's my millennial brain. I don't know, but if there's a problem in my head, I'm looking for a solution. And so at our clinic, we were having a problem with our clients. Everybody that we serve is uninsured or underinsured, meaning they don't have health insurance, or they possibly may have just family planning where they can go, like a female can go and get birth control or what have you, but they don't have health insurance. And so we were referring, and I'm trying to make this story short because I get passionate and I can ramble about it, but we were referring our patients out to see a nutritionist to help with analyzing their diets and what they're eating and all of that good stuff. We were referring them out of office to do that. She called me one day and said, "Hey, your patients aren't showing up for their appointments." And I'm like, okay, what's going on? Because we're scheduling the appointments, we're providing transportation, we had an agreement where the appointments were free. I didn't realize what was going on until I did some deep diving, and I realized the local office that we were referring our patients to did not have a translator.
Ah.
80% of our clients that come into our free clinic are bilingual, they're Spanish speaking. And so they had nobody there that could communicate with them on site. And so in my mind, I was just like, oh my goodness, we need to figure out how to solve this problem. And I know to some people that might sound very simple, but a language barrier
Yeah, it's not
to
simple at
somebody
all.
who, that's not simple, and it's very complex to navigate sometimes because they're stuck trying to find out, okay, I need these resources, but how do I get to these resources? And
Yeah.
so I said, okay, I know AI, I know GPTs. Let me see if I can create a GPT that can navigate this language barrier. Well, of course you can, because AI has that capability where it can translate anything into any language, Spanish, French, Dutch. So I began to think like, okay, how can I do this? So I developed a GPT that allows our community health workers in our clinic to function as nutritionists. Um,
Wow. And I remember being on the phone with you when we were having this conversation, and I said, "Come again."
yeah, I was just like, okay, I can do this. And so the most important thing was making sure that we were able to provide this counseling in Spanish. And
Mhm.
so I started, coding and playing with these GPTs. And I was like, you know what? I can 100% do this because the GPT is going to be able to translate in whatever language that you need. And so once I started, I don't know, it was just like, how you have that light bulb that people put up
Right
here?
now. Mhm.
When that light bulb went off, I was like, oh my goodness, I'm on to something here. And so I just started creating different GPTs for community health workers. And don't get me wrong, any professional can use these GPTs. I hone in on community health workers because I had to use the resource that we had. We
Yeah.
already had community health workers on staff that we were paying. And I was like, okay, I got to figure out a way I can do this. And so
Now
GPT was
tell the listeners though, because I want them to understand what the output is. Like, you created this GPT, you call it the nutrition nav, or is it Nutri Navigator or Nutrition Navigator?
Nutrition Navigator, and I say for short Nutri Navigator. So it's
Okay,
the
so
same
the
thing.
Nutrition Navigator,
Mhm.
and tell me exactly what the CHW does on the iPad with ChatGPT. What information is put in, what comes out, so that they understand exactly what is being done.
Yes. So what the community health worker is doing is we have an iPad that our patients get as soon as they come into triage. And so right when they're doing their, turning in their forms and everything else, we give them an iPad and it has a quiz on it. This quiz determines their food persona or their food profile based off of their dietary habits, what they eat, um, do they eat out of convenience? Are they always grabbing fast food? Or are they huge vegetable eaters or meat eaters? So there's 20 questions that this GPT is going to go through, asking them about all of this information. What that GPT does at the end, it gives them a food persona. So are you a convenience eater? Are you a health nut? That's just some of the names of the personas, and
Mhm.
it allows the community health worker to deep dive into their eating habits. So then this patient goes back and they see their provider and talk to their provider about whatever they're seeing them for that day, whether it's a woman's clinic or a diabetic clinic. But our community health workers then pull them in after their visit, and now they're able to sit down and have a one-on-one conversation about their nutrition, about what they're eating, and how what they're eating plays such a huge part to their health.
So, if for those of you that are following or not following, I have just heard you say you completely eliminated the position of needing a nutritionist, that you utilize this chat GPT for your CHWs, that you're utilizing it to address a language barrier,
Mhm.
that it goes and then helps to provide patient education that is individualized based on the food persona that is developed. Did I get all that? Did I miss anything?
That's it.
That's
That's it.
when I heard that, and I don't think we'll get into tonight the other way you use it for clinical triage. Look, if y'all want to know how Brittany is using it, she'll leave you your details at the end, because I really want if this is something that you're interested in learning how to create, or if your organization is learning how to wanting to implement this in your organization, she is your consultant and she's going to give you some details. But there is other ways. We're not going to get into it tonight. That just blows my mind, Brittany. And I remember when we had the conversation, I said, wait a minute, because y'all been doing this for a year. Am I wrong? I
A
think you
little
said
over a year now. Yes.
little over a year. And I said, how did you get leadership to approve that? And she said, oh, it was not easy. So tell us a little bit about that, because we've talked about this, right? Public health, is it evidence based? Is it research based? Got data privacy concerns, ethical
Mhm.
considerations, misuse. We know all the challenges, all of that stuff. Tell me what those conversations were like, and what your not it's not even a rebuttal, but what your responses were of assurance to your healthcare, to your leadership team, to even be able to utilize that in your clinic.
So this is a loaded question. Oh my goodness, I probably could talk about this for the rest of the time. Long story short, I'm not clinical. I don't give clinical care. I work on the operations side. And so my first meeting that I walked into with our board of directors, and I want to tell this because I was shut down when they started throwing those terms at me like data privacy and how are you keeping the PHI private and HIPAA violations. And I was like, wait a minute. All I did was create a solution to a problem. But then I realized that public health has so many stipulations, like you said, that they're looking at from the clinical side. And
Yeah.
so I
I,
had to,
yeah.
yeah, I had to sit down, and also from a legal side too.
That's true. Thank you.
Um,
That's the priority, because we can't get
I
sued
had,
up here. Yeah, that's the priority.
yes, because the board is looking at how can we use this, but make sure we don't get sued, make sure we're not violating any laws and violating our confidentiality. And so what I made sure to do, programmed into my GPTs, is that one, there are no HIPAA violations. This GPT does not take any PHI.
Love
You do
it.
not have to put in a name, a phone number, an address, an email.
Hey.
It does not need any of that information when you are doing the quiz to find out their food persona, when you are developing a meal plan or giving nutrition advice. It doesn't take in any sensitive information from your patient. So
Wow.
because it's not taking that PHIN, one of the questions that I was asked, and I was just mind blown. I was just like, one of the directors asked me, "What do we do if it gets hacked?"
Hmm.
And in my mind, I thought that was such a simple question because I'm thinking, well, what are you going to do if your computer at work gets hacked?
It's correct. Yeah.
But
But
I
that
really,
has PHI though. The computer
yes.
at work has protected health information. Yeah.
So I was just like, I felt kind of defeated because I was like, y'all are asking me all of these questions, and I'm just like, but I understand that these are things that we do have to talk about. They have to be in the conversation.
Yeah.
And
Yeah.
so when you're working with AI and when you're building GPTs or building any kind of system that's AI generated, you have to make sure that you're checking boxes. You want to make sure that these systems are not taking any PHI in. If you're automating, where is that information going? And so, because you can use AI to automate tasks now and send
Yeah.
out appointment reminders and things. So I just
Which we
always tell,
which yeah, I mean the list
yeah,
is endless how we've been using
mm-hmm,
AI mean, I could be here all night. The list is endless. There, there's something else that I remember that just came to me because they're thinking about it from the legal aspect and all the other ramifications and all that, and having to protect the organization. I was thinking it from a business aspect, and I think remember I sent you an email after and I was like, wait a minute, how have you protected this, right? Because this is I know you also license this out to other
mm-hmm.
organizations with your business. Talk a little bit about that because I'm like, wait a minute, what if somebody recreates this GPT and all of this stuff? So share a little bit about how you're able to protect the intellectual property that you designed.
And so it's exactly how you said it. I protect my intellectual property by making sure I have a license and software agreement. When I am allowing other, whether it's clinics or whether organizations to use these GPTs, there's an agreement in place, and that is solely to protect my intellectual property.
And I think you
Um,
said it's
Another
reverse
way,
engineered or cannot be reverse engineered.
and I was just about to go into that. Another way I do it on the front end, that's kind of like the back end side. But on the front end is I have ensured that all of my GPTs cannot be reverse engineered. And so what that means is a lot of people are creating GPTs, but they don't realize that if they're public or whoever you share that link with, they can go in and ask that GPT about the source code and how it was programmed. And
Mm-hmm.
so I'm giving a tip. If you're creating GPTs out here, make sure you're telling that GPT that you have to put in safeguards where it can't be reverse engineered.
Yeah, I love. Like, hey, man, that was a pro tip there. And so for those of you that those of you that are like, wait a minute, she monetizes this, right? So GPTs can be monetized. Don't worry, you'll have a training coming soon. Okay, so this is so good. We're at 6:45 now. Okay. We talked about favorite. We talked about tell we just alluded to the challenges. I don't really want to go there. We kind of know what the challenges, right? I said there were technical skills gaps, ethical considerations, data privacy, security concerns. Um, we'll go past that. What are the pros? What are the pros that you see, and why you use it and are such an advocate for this being incorporated more in public health?
There's so many pros. Oh my goodness. But number one is the ability to problem solve.
Mm,
In public health, we do a lot of problem solving. It's not just I don't know if I know you're familiar, but I don't know if any of the other listeners are familiar with the social determinants of health.
they better be.
And when you're looking at the environmental things that are going on in neighborhoods and homes and schools and where you learn, where you eat, where you play, all of that affects your health.
Mm-hmm,
And
mm-hmm.
so when you're looking at public health from that totality, we do a lot of problem solving. And AI has the ability to problem solve, but it has the ability to problem solve more efficiently.
Yeah.
And so, just like I used the analogy earlier, what might take Brittany an hour to do, AI can do it in the matter of minutes.
Yeah. And,
So, when you're looking at the time that you're saving, the ability to work more efficiently, one thing that we have been talking about more and more, which I love after the pandemic, is self-care and burnout. Well,
yes.
what leads to burnout?
Yeah.
Having to solve 50 million problems with no help leads to burnout.
Decision fatigue. Yeah.
Yes. And so I always say, and for some people who don't understand how tech can plug in, tech plugs in so well right there because tech doesn't get tired.
Right.
Tech
Right.
doesn't have to deal with burnout or
Mhm.
decision fatigue. I can talk to my AI bot all day long,
Yeah.
you know? And
Okay, when it
so
gets bogged down, right? Too many users and all that. What do we do? Jump on another one?
on another platform,
Jump
right?
on another platform. Absolutely.
And so
Yeah.
when you think about all of the challenges that we're dealing with in health field in general, the burnout, the short staff, the short on resources, I mean the list is so long. AI has that ability to come in and alleviate some of these problems.
Yeah, with the example of nutrition navigator that you just talked about, I love that you talked about the efficiency. So for me, definitely the efficiency, and it's quicker, faster. I feel that it improves my productivity, and I'm a person that I work fast generally. So if it takes one person, somebody 8 hours, it takes me an hour. And now I have AI, I probably do 3 times as much in that 1 hour. But also the quality of the output. I know my
Mhm.
favorite, I asked my Facebook group, I was like, what's your favorite GPT prompt? My favorite prompt is rewrite this. Because sometimes you just have your brain, you just can't get anything out, right? And you're typing an email response, or maybe you're working on a technical report, and the quality is not quite there. So I love rewrite this and then popping in what I have, and it just makes the quality it's so much better, and it's so much more professional. Um, Another pro is that, and I talked to you about this earlier, is that AI really can serve as a learning or a writing partner. I have
Yeah,
learned a lot from AI, but we have to be realistic in that the information still does need to be fact checked. Like, it still requires human oversight. It still requires somebody being responsible and accountable for making sure the information that is prompted, or that the output is factual and actual, or accurate.
absolutely.
Yeah. So for
I,
me, those are
I
some of
always
the pros.
I
Say that
always
again.
say AI works with AI plus a human connection.
There you
you
go.
need you need you still need people to, like you said, oversee
Yeah.
AI, to fact check AI. You have to use people to innovate because people bring that human connection. When I'm teaching, I always say AI is amazing, don't get me wrong, but AI doesn't have feelings.
Yeah.
It does not have emotions or a soul connection or the ability to tug at your heart like a human does. So you and I know a lot of people think about, AI replacing them. But AI works best when it has that human.
Yes. Thank you for saying that. Thank you.
And,
Yes. It's
and
like I
so
said,
when
it's
you
not
look
going to
at it,
replace you. The human using it is going to replace you. Yeah.
exactly. When you look at it like that, and that's why it has the ability to be so innovative in public health because you're taking that tech, and you're putting that human, the person who has that lived experience, the person who's dealing with this day in and day out. And when you put them together and you're able to solve problems, now you're talking about innovation.
Yeah. I love what you
Now
said
you're
earlier.
talking about
You were
changing
saying I'm not
something.
clinical, right? You take my nurse clinical brain and what I know of, the technology, the AI, and it's like, ooh,
Mhm.
I can use it like this. Ooh, I can use it like that. Ooh, and that can happen in every single area. and specialty inside of public health. Let's take the last few minutes and talk about some trends that you see, in public health. Well, I mean, it's kind of general, but we'll just specifically talk about public health. And one of those we talked about earlier, or we alluded to, was prompting. Tell me what you think about prompting and where you see it moving forward and how it will impact public health.
I see the number one area where I see prompting being a huge help is when you're thinking about charting. Because
Mm.
from the clinical side, after you're done with that patient, how long it takes you to get back to your computer or whatever and chart that interaction.
Yeah.
I noticed today, and we use Athena, our EHR is Athena, that a
Okay.
lot of your EHRs are starting to have the conversation about incorporating AI into the EHR
Oh, that
to
would be
help
wonderful.
with charting.
That would
And
be
so
wonderful.
when you think about things like that, prompting and taking it from a prompting mind to being able to talk your notes or help with charting, I mean, it becomes a whole game changer. When
Yeah.
you talk about using prompting to create GPTs to provide emotional counseling or nutrition counseling or mental health counseling, um, just like the basics, it
Mhm.
becomes such a game changer. And
Yeah.
AI can do this once it is trained, and I want to put emphasis on that statement. Once it is trained, it
Appropriately.
has to be trained appropriately. Once
Mhm.
it is trained, it can do that.
Yeah. And, I went to a nursing conference last fall and we were talking about, because if you don't know, there are positions that people can get hired into called prompt engineers. So it's
Yes.
basically making sure that you're feeding it the right data, which is what we're talking about
Mhm.
here. And I see definitely prompt engineers in medicine and healthcare, but I see the
Absolutely.
need to have prompt engineers in different areas in public health as well. So that's a trend that I see. I from a workforce development site, training all day long.
Training.
As
Get lots of it. Yes.
artificial intelligence gets more incorporated, as clinics, healthcare systems, health departments, community-based organizations start incorporating ChatGPT programs like you described and others, there's going to be training that's going to be needed. So that is a big one for me, and why I'm really invested in staying on top of the trend here.
Hmm.
Let's see, what else do I have? I think, what else can you think of that maybe be a big trend in public health as it relates to artificial intelligence?
I think the ability to analyze large subsets of data is going to be huge because again,
And I think we do that, when I think about COVID and kind of these predictive models and, how they're able, and I didn't allude to it and I did all the research and didn't even talk about it. But, there's ways that we've used this before to predict where the next outbreak is going to be, to
yes.
predict, you know,
Hmm.
um, where, areas of high rates of disease or incidents or something like that. We've certainly done that in healthcare. I alluded to it earlier when I talked about precision medicine or personalized medicine. And that, oh God, that's a whole nother conversation, because we talked
It
about,
is. Yeah.
bad in and bad out, right? Or a lot of the tools, may be good for the general population or for, white people, but not necessarily for black people, because of the way that the data is input and there's a bias already. So please understand, our AI is not new. We've been using it in so many different capacities. Again, it just hasn't been at the individual level, but I'm super excited about that. And just all of the reasons that we've talked about, the benefits and how it will make us more productive and more efficient. And ultimately, our goal in public health is to serve our communities better, right? And to
Yes.
help them be
Absolutely.
healthier And so if it can help us achieve health equity better, I am all for it. And I'm so grateful for individuals like you, Brittany. I asked Brittany earlier, I was like, Brittany, I want to follow and connect with some other people that are in public health and that are trying to do this. Do you know somebody? She was like, nope. I think you have a nurse that you referred me to, and I have connected with her. But we got to get on this. We got to get on the wagon, or we're gonna get left behind.
And I want to say, and I hope I can use this moment for a shameless plug for women of color. We need women and men of color. I'm being biased because I'm a woman, but we need people of color in AI and tech.
Yes, I'm so glad you said that.
Why? Why do we need people of color in this field? Because we know of the bias. For just a prime example, when a lot of these image generation platforms were released, like your Mid Journeys, your Dow E, if you type in generate a image of a woman flying to the moon, that woman was automatically Caucasian. She
Yep.
was automatically blonde hair, blue eyes, no thought for people of color anyway.
Yep.
Anywhere. You had to literally go in and say, generate a African American woman
Yep.
flying to the moon. And so we know that the bias is there
Yeah.
because the people that are creating these systems don't look like us.
Right. Right.
And
And
so it's
just the
so
bias.
important.
Absolutely.
It's so important for us to get in these fields for that reason.
Reason. I just shared this with my students yesterday during our workshop, and I said, I have a nonprofit, Diversity and Diabetes, and I said one of the things that we struggled with was trying to find a Black person wearing a CGM, or a Black person, or a person of color wearing an insulin pump. Could not do it, but I could easily go to Ideogram and put it in there. And I think actually what I put, I said create, picture of community health worker holding a sign that says "We'll work for pay." And the images were beautiful. They were beautiful images, and I had
Mhm.
several different images to choose from. And I'm like, this is just mind blowing. So, Brittany, I want to wrap us up. This has been such a wonderful conversation, and for those that, thank you so much for engaging and chiming in, and all of your feedback and questions. Where can people find you? How can they connect with you? Because I know people are going to want to schedule some discovery sessions with you, and to find out how you can help them either individually or with their organization incorporate artificial intelligence to help improve the population or the public, the community that you're serving. So how can they find you?
Absolutely. I am on LinkedIn. I am on Facebook under my name, Britney McGill Mazyck. Don't ask me why I use my whole name. I just recently got married, so I like to keep them
Oh,
both.
congratulations.
But if you're interested in maybe booking a consultation or just having a conversation, I can be found on my website. It's 31st and Co. So www.31standco.com.
I love it. Thank you so much. And again, I'm Quisha Umemba. If your organization is in need of workforce development, continuing education, professional development, any kind of training, capacity building, visit my website, umembahealth.com. Book a free discovery session. I'll be happy to talk to you about how we can help meet your training needs. And if you are watching and you are an aspiring or current public health consultant and you need help starting, growing, or scaling your business, please visit my website, quishaumemba.com. I'd love to see how I can help support you there as well. Oh, and I also have to put in a shameless plug as well. I just recently wrote a book, Public Health Entrepreneurship, Navigating the Intersection of Purpose and Profit. You can find it on Amazon, or you can go to quishaumemba.com/book. If you're interested in snagging that book, it is so helpful. Talks to you all about public health entrepreneurship and how to start, grow, and scale your business. This has been a fascinating conversation. I feel like
You've
this
been
is not going to
amazing.
be the last conversation. I'm so glad to know you. I am so glad for what's in store for us. And I hope that everybody is ready, because the AI wave is coming. Yeah, it's
It's
coming.
already here. The
It's,
AI
it's
wave is here.
here.
It's
Right.
here.
It's here.
Yes.
Awesome. Thanks so much. I've enjoyed you. We'll talk soon, Brittany. Take care.
Thank you so much. Bye.